Social determinants of health are defined by the World Health Organization as conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at the global, national, and local levels. To frame the discussion today, we'd like to specifically talk about things here in New Albany as well. I'd like to share with you that the New Albany Food Pantry has done a tremendous job in serving our community this year. From January through October of 2020, we've served 261 New Albany Plain Local School households. That's 928 individuals, 50% of which are children, and we served 131,000 meals. Woo! Unbelievable. So wonderful. Thank you. This is an increase year over year. We're up 62% in households this year, 58% increase in individuals served, and 52% increase in meals from just last year. I think it's important to understand that food insecurity is here in our community and to understand some of our demographics here. One very important thing to note, which we find often people don't know, is that 50% of our students on the New Albany Plain Local School campus do not live in 43054. So 50% of the students that attend school on campus do not live in the zip code 43054. They live in the surrounding areas that make up New Albany. So that's just a little bit of information about our local community. And I'd like to start and allow our esteemed panel to answer some questions for us. And the first thing I'm going to start with is a three-part question. First, what are the social determinants of health? Second, can you describe how they impact individuals and the community at large? And really, why do we care?
You start with an essay question. Should have made it multiple choice. I could easily answer something. Hi, I'm Bob Murray. The social determinants of health is a concept that's kind of evolved over time, where the different components in a family's life have been shown to directly impact their health and their mental health. And so you have, obviously, food insecurity is one that's very much up front, but there are other things, their education, their not just their socioeconomic status, but their social status, their sense of power or powerlessness, cultural things within their community, and even gender issues and things are part of a composite that really makes up each individual's social determinants and then impacts their likelihood of health. Obviously, we think in terms of ethnicity, African Americans, as everyone knows, have a much harder time getting access to good health care. And they don't, for many, many different reasons. Just that one thing is enough to put them in a different class than other people who have easy access to health care. And so the social determinants aren't one thing working on health or mental health, but it's actually the composite of all those things and how it changes in your lifetime. It's a very interesting concept and something we see directly in practice every day.
Thank you. I'm Dan Remley, and first of all, thank you for inviting me and getting me out of my basement. I've been working in my basement since March with COVID, so I was really very excited to actually come and talk to some real people. So I work for Ohio State University Extension, and maybe we're in the College of Food, Agriculture, and Environmental Sciences. And Ohio State is the land grant university here in Ohio, and so as such, our mission is to actually work with communities across the state and apply knowledge and information in these communities. So I work all over the state. I do a lot of diabetes education and work a lot with food pantries across the state and try to get food pantries to procure healthier choices for people and to promote health and that type of thing. Great to see that you have a strong food pantry here in Albany. So happy to see that you started that. The one thing I want to say about social determinants of health is that, if you were to look at some maps, I love looking at maps, but if I were to show you a map of where the high rates of diabetes are in the state of Ohio, and if you've ever seen these maps where they're color coded, so the darker the shade of red are the higher rates of diabetes. If you were to overlay this map with a map of poverty or food insecurity, you would see that these maps align with each other. So all the places that have high diabetes rates also are those counties that also experience high food insecurity and high poverty. So people that live in areas that are high poverty, high food insecurity also experience higher, they have a higher risk for these chronic diseases like diabetes, hypertension, heart disease, and that type of thing. So maybe you've heard too that the zip code that you're born in actually is a bigger, is actually a more, it's a higher risk factor for whether you develop a diabetes on your genetic code. So zip code is just as important as genetic code when you think about, how healthy you're going to be and your risk for diabetes and chronic disease. And so we really need to look at those education, poverty, food insecurity. We need to look at those upstream factors when we think about how can we prevent, how can we manage many of these chronic diseases, and even COVID too. We're seeing a lot of these inaccuracies in COVID. So.
Thank you. And I'm loud, so I'll let you all keep the mic. The next question I have is, can you discuss crisis and circumstantial poverty and the long-term effects of COVID on our community?
So circumstantial poverty is somebody who's maybe they've been food insecure, but they've lost their jobs, or maybe you've had one spouse that lost their job, and so they're experiencing poverty and food insecurity maybe for the first times in their life. Other people come from situations where maybe they grew up in poverty, they grew up in food insecurity, their families were food insecure, so it's more of a kind of more of a chronic generational type of situation. I think in some of these suburbs like New Albany, I would suspect that there's both types. There's people that are maybe experiencing food insecurity for the first times in their life, but then again there are pockets here, and maybe it's a low income housing area, apartments, a trailer park that's located near here, may not be in the zip code, but near here, and you have more of the kind of generational type of thing. So you have both, and it's important to recognize both. The situations are unique. Somebody who's new to poverty may not know where food pantries are located. They might feel ashamed to even use a food pantry. Whereas people that have been living in these situations for a longer amount of time, they're more aware of social services that might be available. But they have unique issues as well. So it's important to consider both those types of situations. And then you mentioned the pandemic. I think the pandemic is really shining a light of this situation, that people that are experiencing these inequities are even more likely to have jobs where they're more exposed to people, and they're working service jobs or working in grocery stores, and so they're even more likely to experience COVID problems. So.
I'm really interested in, I think most of us think about the more established, impoverished families when we think about poverty. But the circumstantial poverty is the scary one to me, because it's unpredictable, and it can be something fairly minor. You think about the poverty level in this country is about, I think, $22,000 a year for a family of four or something like that. And so you think about, it takes almost nothing to push them over to where they simply don't have enough money for all the things that they're committed to, their rent, their light, their water, their phone. And so food insecurity wraps itself in there as something that comes and goes for these families. I've always been struck by, if you look at SNAP families that use food stamp SNAP benefits, they come and go on there in a matter of months many times, because something happens. If your car breaks down, you lose your transportation, you lose childcare. All of a sudden the ripple effect goes all the way through, and that's really the basis of why the social determinants affect health and mental health so directly. Because it's not a single issue. It's not food insecurity, but it's food insecurity wrapped in transportation and employment and childcare and on and on. It's a very difficult problem. And that's why we built our safety net in this country to prevent that. So you mentioned COVID. We went through this with the recession, which was a breathtaking recession. When you look back a century, there was nothing like that ever, a recession, that magnitude. And all of a sudden, every single one of the social safety net programs, enrollment went through the roof on all of them. And it took us years. We finally got 2013, 14, we finally got back on track with getting people back and more secure. And now COVID's doing exactly the same thing. We're going to go right back 2020. So these are the kind of things, I mean, that kind of circumstantial thing is hidden from us a lot of times. I live in Arlington, you're in New Albany, Worthington, Westerville. We think of poverty one way, but it's very much more pervasive. For example, rural communities have breathtaking poverty. The children are really vulnerable in those rural communities, yet we always think of it as an urban problem and even an urban ethnic problem. In fact, in Ohio, we've got great statistics where Dan lives. For example, there are a lot of pockets of very impoverished families that need that social safety net, or they're in deep, deep trouble.
To your point, we talked a little bit ahead of this today, and you had told me a little bit about the trickle-down effect and what percentage of the economy is consumer-driven. Can you address that?
Yeah, I always think, I remember this statistic because I think it's so important. About 71% of the economy is driven by consumer spending. So when you see that begin to dry up, and COVID is a vivid example where you think about the movie theaters and anything social, bars, restaurants, all of that contracting at the same time. People are not spending their money, and that's the driver for the economy. We did the stimulus in the second quarter, and you saw the third quarter statistics were breathtaking. They were wonderful. And it was like, oh my God, things are getting better. They're getting better because we invested in that and gave people money to spend, which allowed businesses and other things to be sustained. When that dries up at the end of this year, we're looking at 2021, and it's going to be a much different thing if we don't, follow the Fed's example of putting more money in the economy. It's a fascinating thing to see, but that'll have a big impact on all the social determinants we're going to want to control next year.
Dr. Remley, you have considerable experience studying food insecurity and poverty in the suburbs. Can you discuss this and specifically address what is unique to the suburbs? Is poverty in the suburbs growing faster than the urban areas, and if so, why?
Yes, so poverty has been growing much faster in the suburban areas than in urban and rural. But one thing I do want to say is that there are different types of suburbs. So in some places, suburban areas are much worse off financially, economically, losing population. I'm thinking in particular some of the suburbs around Cleveland, Akron and Youngstown, and yeah. So there's a lot of declining suburbs there, and some suburbs are kind of older industrial types of places too that are outside the cities that are really experiencing a lot of economic hardship. But then you have the suburbs like New Albany or Westchester, Ohio, which I've worked in just north of Cincinnati, Liberty Township, those places that are those bedroom communities for Cincinnati and Dayton. Which, when I moved back to Butler County, I went to Miami University and moved it, did graduate work, came back. Butler County, where I worked at Extension, it was all farm. Most of it was just farm fields. And then in the span of 10 years, all kinds of new shopping centers and new neighborhoods and that type of thing. So a lot of wealth in these new suburban areas, but then again, there's kind of these overshadowed pockets of poverty. So these areas where it might be a trailer park, it might be an apartment complex, low-income housing. These pockets of poverty that are hidden, embedded within these wealthier communities. And in many cases, and actually, if you look at the suburbs collectively around Cincinnati, Dayton metro area, there's more poverty in the suburbs than there is in the inner city. And we see that across the nation. They've done research, there's actually more poverty in the suburban areas than in the urban areas. So what's unique and challenging about food insecurity in the suburbs, in a particular place like maybe like New Albany? A person who might experience, like Dr. Murray was talking about, cases where you have situational poverty, so somebody loses a job. In a lot of cases, they don't have the knowledge or awareness about where to go for help. That infrastructure just isn't there. We do know that people that live in suburban areas are less likely to participate in food assistance programs like SNAP. A lot of times the offices where they can sign up aren't even located in the suburban areas, so they have to travel a long ways. Another complication is the whole idea of stigma. We've also found that, for example, kids that are living in suburban schools are less likely to participate in free and reduced lunch because of that stigma element. They're ashamed to, participate in those programs. There's also a program called the Backpack Program. I think Mid-Ohio supports that program. So eligible kids can get a backpack of food to take home. Well, we do see in the suburb that the rates tend to be a little bit lower and there's more stigma associated. Now, at Chillicothe, when my kids go to school, they have free and reduced lunch. So that's really nice. It's nice that we used to, pack their lunches. Now we don't have to do that anymore. But it's good for the kids that really need that. They don't feel stigmatized. I think schools have done a pretty good job trying to reduce that stigma. But it is a big issue in the suburbs. And people, again, there's a stigma of using a food pantry. So we have those issues. Access to social services is challenging, and our suburban communities were, for the most part, designed around the automobile. And so if a person loses a reliable access to a car, that can be a real challenge in terms of accessing food. We did a community-based participatory research study in Westchester, Ohio, Butler County, and we interviewed some people that were experiencing food insecurity in a low-income area. And this mom said when her truck broke down, she didn't have a truck for 10 months. And she used to buy fresh apples all the time. And then when she lost that truck, she said, I had to rely on my neighbors to get to the grocery store. I couldn't buy foods that didn't last very long. So I bought a lot more foods in bulk, a lot more foods that were, highly processed that could sit on the shelf. You probably heard that rumor that Twinkie can last for 20 years. I don't know if that's true or not. Yeah, right. So people would buy less fresh because they just wouldn't last as long. And it does impact the types of foods that you buy if you don't have access to that, to those grocery stores. People will walk, a lot of these communities don't have sidewalks. This one community we were working with, there weren't sidewalks connecting to any grocery stores. The closest store was a Dollar General, which is actually, in many rural places, that's where people get food, these dollar stores. But she would send her son to go fetch some milk or some food at the dollar store. He would risk his life to get there because there weren't sidewalks. So there's all those types of transportation challenges that the suburban areas have as well. So there's resources, just people aren't aware, and that infrastructure doesn't support. Especially, it's extremely challenging for people that don't have that reliable transportation option.
Karima mentioned that to me. She gave us a term that I hadn't heard before, two actually. One being resource poor. So a wonderful community like this could in fact be resource poor because the people that are in need don't have the infrastructure to go seek the services they need, for one. And two, she gave us the word NIMBYism.
Not my backyard.
Yes, could you talk about NIMBYism?
Yeah, so people just aren't aware that there's poverty or food insecurity. They kind of overlook it, and they so sometimes it's just bringing awareness to the community that, hey, we do have a problem of food insecurity here in our community. And in Westchester, we created this story map, so it kind of it showed the lived experience for people, living with food insecurity. People actually documented what it was like to access food in the community. So they took pictures of the lack of a sidewalk. They said, I don't have a sidewalk, but I have to get this store. So they would document just some of the real-time challenges. We interviewed this one lady that, she was talking about all of our master's and she was talking about I have a very limited food budget, so I don't take any risk when I go. I buy only foods I know my kids like. We gave her $20 to spend. The first thing she bought was pineapple. She says, I never bought a pineapple. I didn't know if my kids would like it or not. Fortunately, they did. But she said it allowed me to experiment a little bit. I was able to step out of my comfort zone and experiment and buy some foods. I didn't know if my kids would like them, but that's what that allowed me to do. And so, it's there. And I think raising awareness is really important. I think it can be done through social media, getting people involved in the food pantry and talking to people. That can be really helpful as well.
Dr. Murray, could you discuss the importance of the whole child model as it relates to the quality of a child's life?
The new CDC model that has been adopted by schools has been the whole child, whole school, whole community. And it really is a series of concentric circles around the child. And we always think about education, but education is just one piece. There's health and there's mental health and there's, teacher wellness and the whole school, the whole world of the child is really represented there. And that's a very different concept from the educational system. We kind of had a dance with the educational system between health and education just a century, starting in about 2000. Educators began to look more broadly at what education meant and who they were educating, and the ability of that child to become educated is many times predicated on their social determinants. So if I take a child and I have a hungry child, if you look at brain scans on a hungry child, their front brain is not what's going to light up. It's not their cognitive brain, it's their midbrain. It's very much their emotional, food-seeking, worried, anxious brain. And you can't put that child in that circumstance and expect the same outcome as a child who doesn't have it. So these are the things that we've kind of put together in cooperating with the administrators of school, begun to look at that whole model. The piece of the model that is highly variable is that community piece. And the community's attitude toward itself and its culture of health and its designs for its children has everything to do with whether that model really resonates all around that child or only in their school environment.
Well, I guess to that end, and this is another term that you gave us in our pre-discussions, is the floating of all boats. So could you discuss the importance of early nutrition, nurturing, and environmental stability, and how this can be a community investment and how communities can float all boats?
Yeah, we were talking about, when you look at the scientific literature, particularly in the last 25, 30 years, there are three elements that keep coming up with a good scientific evidence base that make a difference in the child's academic performance, social performance, employment, mental health, health tracked over 40 years. We have some of these studies that are now out beyond 40 years. And those three are, they're nurturing. They need an adult, does not need to be the parent, but they need nurturing and support from some adult, make them feel that somebody's got their back and is worried about it. Two, they need good nutrition. And if they don't get good nutrition early, the ramifications are enormous. Little child's brain's going to triple in size in 36 months. They better have optimal nutrition while it's trying to wire. It's not something you can do a do-over when they're 10. You have to really have it there when they're young. And then the third is the environment. Kids are like all little mammals. They're very curious about novelty. They love newness. I always try and tell students, you watch a child sitting on the rug, the little rugrats, and you say, if you ask the parent, what are they doing? They say they're playing with their toys. But what they're really doing is studying everything in their environment to understand what it is. They don't know what it is, and they don't know what it's supposed to do or what it could do. So they use their little skills and they bang and they taste and they rub and they try to figure out what each and everything is. And so that newness, that novelty, and the support of a nurturing adult is what lets them explore and be comfortable exploring. The ones who don't have those elements tend to be anxious, more internalized, much less social, and have much harder time in school and later in life. So yeah, you can, if you think about the community helping to strengthen that net under all children, then you give them all a shot at doing the best they can do genetically. But if kids who are stripped of those really pay a price for a long.
Well, it sounds like you're talking a little, it runs into mental health at that point. So can you discuss maybe the mental health and the repercussions and the lifelong repercussions of toxic stress on kids?
Well, yeah, the literature began to build about 30 years ago, and people were realizing that stress is what teaches us, really. You think about, I always use the example of a kid learning to climb the stairs. They climb the stairs, they fall down, someone picks them up, gives them a hug, you put them on the ground, what's the first thing they do? They go back to the stair and do it again. You know, they keep doing it until they master it. That's a positive stress. And you use that nurturing to overcome any ramifications of stress. And then there's tolerable stress, where you put a child in a circumstance that might be really devastating. They lose a parent, there's a fire, there's a hurricane that wipes out their entire city, and they end up in Houston, Texas or something. And that child, if they have the social skills and the nurturing and the support, can overcome them, and it doesn't destroy them. Problem is that some of those things are felt by the child to be overwhelming. They don't have the skills, they don't have the support, and they end up being isolated. And that's toxic stress. And that wires the brain in a different way that is irremediable. It does not change over time. You can get into anger management later, but you're not necessarily going to fix the way that their makeup is formed. So as pediatricians, we're very conscious now and very concerned about whether or not the child has the social and emotional skills to handle the ups and downs of life. Can't make those go away, but if I can give all those kids those skills, I can make them able to do well.
And you were kind of describing to us what that looks like down the road. So if that happens in childhood, what is happening with this child in adolescence or even in early adulthood or adulthood as a result of that?
Yeah, the trajectory is fascinating. The toxic stress, they have a score that really scores your circumstances in terms of stress. And unfortunately, many people in society have a pretty high score. And when you see the child who's in the very high score area and is experiencing toxic stress, as a child, they don't do well socially, they don't do well in school academically. They tend to act out a lot of times and be either anxious or irritable and so forth. So there's behavioral things as well as academic things. When you follow them into adolescence, they get in trouble with the law, with drugs, with alcohol more commonly. You follow them out a little further, they don't have optimal employment. They don't complete more years of education because they don't do well academically. And when you follow them out to 40 and 50, they have health problems, including metabolic problems, obesity, diabetes, hypertension, dyslipidemia, all the things we talk about at a much higher rate. But also they have mental health conditions during that time, and they tend to die young. So you see this trajectory, and you see it tied directly to the stress score. And you realize that if you had mitigated that early in life, you might have made that a tolerable situation, and that child's whole life trajectory could be altered by an investment early in life. That's a real important finding.
And Dr. Remley, is there anything I know you've done a lot of research in Butler County with the community-based research project and these lived experiences. Is there anything you would add to that as it relates to the mental health aspect, or even just COVID and how we're living these days right now?
Probably would add, I think a lot of our experiences are relative, right? So if you live in the inner city and all your neighbors have experienced poverty or experiencing similar types of situations that you are, I think it's, to me, it's probably a better situation than if you're living in a more affluent area and you're experiencing poverty for the first time. I mean, there's a lot of stress that goes along with that. You're starting to compare yourself with your neighbors, and it's kind of like trying to keep up with the Joneses, and that's in many respects that's I think a more challenging situation. I think, and especially with COVID, we're going to see I mean, the economy I don't think has bottomed out, so we're going to see. I feel kind of like Debbie Downer here, but there's going to be a lot more people that are going to be losing their income, and I think there's going to be some real challenges here in these types of communities. As I said earlier, people may not know where to access food assistance, and there just really isn't that infrastructure, that sort of that community knowledge that somebody who's living in an urban area might have, how to access some of these resources. So I think, unfortunately, too, another thing about the suburbs I wanted to mention, that if you look at an issue like food insecurity or even poverty, you can even look at a place like Franklin County, New Albany, very low rates percentage-wise, but when you look at all the suburbs combined collectively, there's actually more people that are experiencing food insecurity and poverty in the suburban areas collectively when it comes to the raw numbers. And so, 10% of Westchester, Ohio, that's 30,000 people, 40,000 people. So the numbers add up, and as I said, I think the issue of stigma, trying to keep up with the Joneses, that sets up a lot of stress and anxiety for a lot of people.
And how do we get ahead of it? I guess that's our question. We have a lot of doers in the room and online. How do we get ahead of it? What can we do here to mitigate that in advance as opposed to being reactive?
I think raising awareness and getting the right people to the table. You have a lot of resources here, a lot of community capital, a lot of financial capital here, a lot of human capital, cultural capital, just bringing different diverse stakeholders to the table, raising that level of awareness. Because I think there's a lot that can be done. There's a lot of resources that can be marshaled on an issue like suburban food insecurity. So,
one problem we do have here is that a lot of times funding is difficult to get in the suburbs, particularly here in New Albany, because we are considered a wealthy suburb.
right.
The poverty
Low
density
percentage.
is less. We often don't meet the poverty density thresholds to qualify. So what would your suggestion or thoughts be kind of around that topic?
I think grants are nice to have, but the problem with grants is that the grant money runs out eventually. So if you can get the lumber company to donate lumber to build a community garden, or get Lowe's to donate shelves for a food pantry, I mean, that's a more sustainable situation. I mean, as I said, you have so many different resources here. Just trying to marshal these resources to a topic, getting people to sit at the table, looking at a common issue and having everybody contribute to that issue. That's a more sustainable issue than getting some big grant that runs out. Now, it's nice for me to get a grant because if I'm working on tenure at Ohio State University, say I got this grant. A grant does help you get things started sometimes. And that's to kind of infuse a little bit of capital to get a project going. But boy, if you could bring people together and bring different sectors of the food system together, for example, getting healthcare involved, getting stores, grocery stores involved, getting food pantries all sitting at the table, farmers, getting them all working on a common issue, you can get a lot done, and you can create projects and situations that are more sustainable than if you were to get some big grant. Sometimes grants can be helpful. It's bringing a person that's sort of like the backbone of the coalition or a council or a food policy council, getting a paid position, and sometimes that's where grant money can be helpful. But boy, if you can use the resources in your community to get some things done, that's a better situation.
Another question is, Karima and I talked a little bit about the resiliency model and how it can be employed in the suburbs. Could you talk about?
Yeah, that's Karima. I don't know.
Okay.
Yeah, I don't know, Dr. Murray, do you know anything about the resiliency model?
I know about resiliency, but not the model she's talking about.
Yeah.
How about collective impact?
Okay, I do know about collective impact. I'll have to ask Karima about what that is. So collective impact is kind of just what I described earlier, just different groups of people coming together, people representing different sectors, maybe of the food system, if you're going to work on food insecurity, all working on common goals. Michigan, that state up north, I know that sometimes I admit I'm from that state up north. I'm a man without a home. I go home and everybody gives me a hard time about working for the Buckeyes. And then I come back down here and everybody picks up on my Michigan accent sometimes. So collective impact, I was going to mention Michigan because Michigan has what they call a good food charter. So they have a set of goals that everybody's working towards. And so one of those goals is to get 20% of all institutions like schools and prisons and that type of thing to source locally, so source local foods. So everybody's kind of working towards those common goals. And we can see that locally too, like just goals that everybody's kind of working towards, that everybody's contributing to. It's sort of like a shared vision, a shared, shared agenda. And that can be really, really helpful. And that's what the collective impact is. Everybody kind of working towards common goals, and it's understood what those goals are. Everybody's interested in working on that agenda.
And in a community like ours, maybe off the top of your head, what are some of the key individuals that should be part of that collective impact project?
It kind of depends on the topic, I guess. When it comes to food insecurity, it could be farmers, it could be stores, like grocery stores, retail, definitely food pantry. If you have like food processing companies around here like that prepare like packaged food or canned food or that type of thing, that can be helpful. Institutions that prepare food like schools, hospitals, prisons, those types of community, those types of organizations. Public health is always a key player. Extension can be important to bring on board. Businesses, any types of businesses. If you have financial institutions that, like you have nationwide here in Columbus, having them at the table that have that access to financial capital, that's always great. So the more diverse your council, your coalition is, the more impactful it can be in terms of achieving the collective impact. That's a challenge too. You really have to know what brings people to the table. Getting somebody to come to a meeting that's at 6 o'clock and they're busy with their families and they've been working all day, and there really has to be something in it for them, or they have that's important for who's ever facilitating these groups to understand what brings people to the table, and then helping them identify those common interests and the common agenda that they're working towards. It's always a challenge. You want to be as inclusive as you can, but at the same time, it's sort of like balancing the process, getting everybody involved and getting their voice heard, but then making sure at the end of the meetings, people feel like things are getting done, so people don't feel like they're wasting their time. And everybody has competing agendas. Some people want to do this, some people want to do that. So that's always a challenge. I think in terms of food insecurity and working with food councils and food policy councils, one of the challenges is getting people that are experiencing food insecurity at the table. And it's especially in rural areas, there's a lot of reasons that people don't come to meetings, but if you're living in poverty and you're living with food insecurity, then it's even more challenging to come to a meeting and talk about some of your issues and contribute to the discussion. But that's really, really important. If you're going to work on food insecurity and you're going to work on healthy food access, you have to be working and talking and engaging with people that are experiencing food insecurity. And you need to know, what would be important to them and what wouldn't be important. And otherwise, a lot of your projects that you're working on might not be really relevant, and we see that time and time again. But it's building that equity, really amplifying those voices, because if you're living with food insecurity, you might be less reluctant to come to a meeting where there's a guy like me that's middle-aged, glasses, white person and highly educated. That can be intimidating to a lot of people too. So, and that's where you get into the food councils, making sure that you build that equity into your work and really engage with people that you're trying to help and work with. So it's sort of a two-way street. It's empowering those people, but then educating other people like me about what is it like to live with poverty? What are some of their lived experiences? Yeah.
Well, I think the other things. There are simple things that can be done that don't require grants and a mass of people. When I started working in schools, I was always fascinated by this. We would find a child who, you know, the family qualified for food stamps. And so they had to go downtown regularly to reapply for the food stamps. And this was taking a day off work, riding buses downtown. But the fact that they were food insecure never really opened up the rest of the safety net. Each one was a little siloed thing. And that process is so intimidating and so angering when we have to do it, like we do healthcare, we have to fill out all the forms and stuff. I mean, I don't care how many years of school I have, it drives me crazy. But if I didn't have those years of school, I might be totally intimidated to not do it at all. So if you can take away the barriers, if you identify a family that's food insecure and you explore the other social determinants and you say, do you need transportation? Do you need childcare? Make sure that they can get access to the whole net. That's how you can be extremely efficient as a community. We just do a terrible job of that in the United States, really terrible. Yeah, everything's siloed. I got to go to Cuba one time to see how a really coordinated preventive health practice is done. And boy, if they identify one thing that's a problem, they put a circle around it and try and figure out all the things and they nip it in the bud. They don't let it get out of control. And anything that goes wrong with the family, they find the social determinants that are causing the problem. Fix it.
Like the ACEs score.
Yeah, it was like the ACEs score. Yeah, any single thing that they identified. I remember they got 2 kids in a school that had, some kind of a flu-like infection. They came in, they quarantined. They did not let it run rampant, and then closed the school down for 2 weeks to get it back under control. It's a difference between prevention orientation and a crisis orientation, and we like emergencies here. Aaron.
So I think it's important to overlay COVID now on top of all of this that we talked about. So could you maybe discuss the impact of COVID on marginalized families in the community?
Well, I'm not doing practice anymore, so I'm not seeing them as much as I used to. But COVID is going to just simply amplify the many, many issues that they already have. I used to have a lot of patients who were single mothers, 2 kids. They come to a health visit riding the bus, a couple of buses, get to me for this 15-minute visit with their 2 kids. That is worsened now because so many other things are now getting in their way. They have to get their kids and do the masks and figure out how they're going to do all this. Every little aspect of COVID is making it harder to be a human, and it's easy for us relative to what it is doing.
I was just going to talk a little about food pantries that I've seen, how they've adapted to COVID, and how it's, in some ways, I think it's more challenging for people to access food in this time. So I work a lot with food pantries and help them transition to a client choice model, as opposed to like a traditional means of distributing food by putting food, pre-selected items in a box or a bag and just give them to people. So with COVID, a lot of our choice pantries have reverted back to more of a traditional model. And so I think that's unfortunate, because if you come to a food pantry and you have type 1 diabetes, or you have diabetes, which about a third of people that come to a food pantry are living with diabetes, or somebody in their household has diabetes, and they don't have that choice now. I think that's a challenge, because they do need those low sodium, healthier food choices. Same thing with people with food allergies. You come to a food pantry, you're just given a box or a bag, you don't get a lot of choice, and your family has food allergies. And foods that are gluten-free and free or this or that, they can be expensive too for families. So I think that's definitely one challenge. I think just generally the economic downturn is a challenge. I think if you're living with poor health insurance, you don't have great health insurance, and you have diabetes, and you lose it, or you change jobs, or you lose your job, that's tough if you're taking insulin. especially, or you need diabetes supplies. So, we're seeing one of the challenges with food insecurity too, if people are making hard trade-offs. So they're thinking about, okay, do I spend my money on food, or do I spend it on diabetes medicines or insulin? So they're making really hard choices. And I think those choices become, even harder when there's like an economic downturn and that type of thing.
Before we jump into questions, I just want to kind of give you the stage. I think you've done such wonderful work in each of your respective fields. As you kind of think and ponder the culmination of your work, if you had the stage to really share what's most important to you about the work that you do, what would that be?
I got to think about this. Do you have anything on top of your head?
I have long been interested in, I got interested in schools back in the 90s as the obesity problem began to burgeon. And I was very interested in what programs do we have available and how could they be most effectively used. And I do think that question is still there for us in communities and in schools. How do we make this work? COVID's making it very difficult to do education and everything, and do everything attendant to school. But I think we still don't use the programs we have very effectively, and we're not necessarily accomplishing for the child, particularly what we say we want to accomplish. And that's one of the most frustrating things about the U.S. is that we say we want something, but we don't do it. And I think that's a very costly thing for children. So getting more and more information, and we just need to apply it more, I guess. It's probably true in the social realm as well as the health realm, as well as the mental health realm. We just need to apply what we've learned.
I think the area that this is sort of maybe a little bit deviating a little bit apart from what we've been talking about is the idea of sustainability, as I've progressed in my career, I've become, and even working with food pantries, when food pantries that give people just pre-selected items, people don't know how to use them, they don't want them. I'm thinking lima beans. I got a can of lima beans. I throw them away. I would not. I don't care. Those are your dietitians here, nutritionists. You can give me any recipe, and I'm still not going to use the lima beans. So when we move these traditional models, revert back to these traditional models of giving people food they don't want, what happens? That food gets wasted. So food waste has been it's been on my mind a lot recently, and we've even seen early on in the pandemic. You probably heard those news stories where the farmers were leaving crops in their field, wasn't getting to wasn't getting to the distributors and that type of thing. So we've been seeing a lot of that going on. I'm personally very, very concerned about landfills and plastic use. COVID has it's sort of an interesting phenomenon going on. Actually, some cities have less air pollution now because there's not as many cars. So you can actually see the sky in some of these cities, so that was really pretty interesting. But then plastic use is up too because people are using more plastic bags and things like that. So I like the backpack, and it seems more and more. I see more and more trash, on the trails. And so personally, I'm more interested in sustainability topics, especially when it comes to things like food waste, sustainable diets. Although experts can't really agree what that actually is right now. I've been to a lot of talks on that, but my kids growing up, and I think about the world that they're going to inherit, especially with the climate change issue, and I'm just more aware about the amount of plastic that I use. I saw some front line that said that, we only a fraction of the plastic we use actually gets recycled. It's a little better with aluminum cans and paper, but there's so much that we consume that we just throw away. It winds up in a landfill or what winds up on the side of the road. It's really, I really have concerns about that, I guess, personally. So a lot of my work is focusing more on those sustainability topics. And even if it's working with food pantries or diabetes, I'm a type 1 diabetic. I have a continuous blood glucose monitor. I have to change it every 10 days. And I have this plastic device that they send me 3 of these devices every month I get 3 of these things, and they're huge. And I think about all this waste that I'm generating. I shouldn't feel guilty about having type 1 diabetes, but there's this kind of this awareness about, geez, just think of all this waste that I'm creating. And those of us that live in these first world countries, a lot of times it gets dumped in Indonesia and in those places. And I know you've done some work with some of those third world countries, and maybe you can speak more about this. But so I'm personally, professionally, becoming more and more interested in these ideas of sustainability. There's been some interesting types of trends and phenomena, especially during the pandemic, that have been really interesting to see. Encouraging, discouraging, that type of things.
Dan mentioned something that's really so fundamental, and that's plate waste. When you go to school, everybody's shocked that about 35% of the food you put on a tray goes into the trash. But it's not just the kids. When you step back and look at the community, it's about 35% that we do as well. And there's a lot of reasons. I remember people criticized a lot of the people who were poor for not buying fresh fruit and things like that. But there's a 25% wastage of fresh fruits and vegetables that don't get eaten. Why? Because maybe because they don't taste good, but also bananas. I mean, they got a lifespan. If you don't get them on the curb, you like throw them away. And so they're not willing to invest in foods that aren't going to be eaten by kids. And you can't blame them for that in that circumstance. You got a limited amount of money. I'm buying 1, calories, and 2, for taste. And I'll worry about nutrition later. We have to really kind of understand that. But plate waste is something that we as a community, in school, in preschools, in our businesses, in our restaurants, we could tackle that as a problem. 35% is a lot, adds a lot of methane and other things to landfills. We could tackle that as an ancillary thing to this whole business of food security. It's a piece of food security we've never really gone after.
Well, thank you. And I'd like to open it up for questions, because I know there are going to be burning questions that generally take more time than we have. So is there anyone that would like to jump in with the first question? Go ahead. I can say
Okay.
it.
The social determinants of health are many. So as a community, we want to help our neighbors. What do you think is the most impact? It's hard to think about all of them, right? It's easy to get overwhelmed. So if we said, okay, as a community, we're going to dive in on the economic stability, education, food, community. What do you think would have the biggest impact, the biggest return, so that we're also not overwhelmed by the complexity of it all?
I think the economic security would be, if we could ever get there, would be the most impactful single thing you could do for families, kids, and everyone. I know you may have, if you were listening to the Democratic things, Yang put forward a very libertarian idea of a basic income for every human being in the country. The data on that shows that if you took a family in power and you give them $1,000 a month, as he was talking about, you change the dynamic of everything, of the way that they purchase, their anxiety, the way they interact, everything about that stability is absolutely crucial. And then other things like food insecurity and childcare begin to fall into place. So part of our, as a country, part of what we have to grapple with is this inequality that we have in income. I'm always struck by the fact when you look at kids who qualify for free and reduced price meals in the US, 55% of the kids in the US qualify. We are not a wealthy country on the ground where the rubber meets the road. Those people, if you got them to a point where they were picking up an extra $1,000, the studies showed dramatic improvements in everything all the way down. So that's where I would go. Part of thinking about the safety is, when you think about food insecurity, it's not just about hunger. You're giving them SNAP benefits that puts a financial floor, as small, as meager as it is. I mean, you're talking about $1.40 a meal or $125 a month per person. That's what the SNAP benefits are. They're not, they're not eating bonbons on that, but it's meant to pull them out of poverty. It's another thing that just protects them from falling over into a cascading effect where they lose their car and their job and then their health. So yeah, it's an interesting question as you look at the social determinants. What's the linchpin? I could fix one, that would be the one I fixed.
I would say probably co-location of services. So like if you come into a food pantry, you can sign up for food stamps right there. Or if you need referral to another social service agency, then the food pantry can help you. Ohio's been good about actually in doctors' offices screening people for food insecurity, and then if they have a problem, an issue, then they can refer them to the food pantry. Testing for diabetes in a food pantry, and then getting them referred to an endocrinologist or something like that. So those co-location of services and that collaboration, I think, is really important to address many of those upstream types of determinants of health and that type of thing.
While you have the mic, could you just address what that means, the upstream as opposed to the downstream?
Yeah, I'm referring to like the social determinants of health, like poverty and education. And so if a person is coming to a food pantry for the first time, then obviously there's a reason for that. And so getting them connected to those services to get them, to build up their food income would be something that would be a worthwhile goal, I think, for any organization. The food pantries that have those co-location of services, they've done research and they've shown that those types of organizations have been more successful at getting people out of poverty and that type of thing. So.
If anyone on Zoom has any questions, you can unmute yourself as well.
Barbara?
This has been something that's been on my mind for a really long time. So I hope I can articulate it. I am a Costco partner, and I walk into that place, and I go to where the food is. Just like you could feed a small country with the amount of food that is in it. It's just unbelievable. Canned goods, packaged meats, fresh meat, cheese, anything you can imagine. And at first glance, you think, gosh, I get a whole bunch of it. It's expensive. But you really start to look at it. So I want to know if there are any studies or this really puzzles me. What is the impact on our communities of these large food distribution centers? And does it have a trickle-down effect to individuals like in the fresh food areas and the money that is spent? And do you know what I'm trying to say? I don't know if I'm articulating it properly, but it's like, what have we done as a society coming into these places and buying all this food and stocking it and storing it, and we're still not affecting the individual who really needs it? Does that make sense? And are there any studies that I almost hate going in there? I do. Like I take a list and I have I need certain cheese, and I'll go out with $20. People go, oh my gosh, $20. I'm like, I know. But you got the cheese that I like, right? Okay. So does that make sense to you? What are the impacts of these ginormous food places, and they throw their food away, and the bananas are rotten, and the avocados, you can smash them with your hand. It's just wasteful. What are your thoughts on that? If there are any.
Well, that whole model of that value model, I think about that a lot because I'm in the area of nutrition, and the value model really undermines that. And so people want more for less. I remember the statistic was when you bought a medium-sized Coke, it was store got, 6 cents or something, and if you buy the large Coke, they get 8 cents. Well, you paid way more than that, so the profit was higher, and it just kind of coaxes people. The other thing I worry about the big stores like that is it's part of the temptation to overspend, to get into trouble. And that is something we have a problem with all strata, all socioeconomic strata in America. And then the third is the sense that if you don't have money, you're now something lesser than someone else who has the money to go into a place like Costco and spend. I don't know how you guys go into those places. I can't get out of there for under $200, and that's a problem. You don't go in there. You don't go in there to buy one thing. You're in there for a problem. So you're buying for an orphanage, I used to say. So I think it is part of the American kind of thought process. The value equation is so powerful in this country, particularly, that it does undermine sometimes what we say we want to accomplish. I think that's always difficult.
I just want to say, this doesn't really apply to New Albany, but in a lot of rural areas, they only have access to one grocery store. They can jack up the prices big time, like the little NGAs in these rural. I mean, Vinton County, which is near my hometown, it's they just got a grocery store about a year ago. So people, I mean, you're really at a disadvantage when there's grocery store competition, because there's competition is a good thing. In rural areas, there's not competition. They charge sometimes twice as much for a carton of eggs. So, but you're right. I mean, my wife sends me to the store to get some bread, and I walk out with about $50 worth of groceries for the lima beans.
Any other questions? Online, any questions? Virtual? Okay. Well, I do have one question to wrap up. So I feel like, and this is a quote that Dr. Murray gave us, that children are only as well as the community. So it's something I did a lot of thinking about. And as we look ahead, as we have a lot of very engaged community members and agencies, what are our next steps? What do? We sit here, we talk about this, and we're all understand it, and thank you so much for your information. What can we tangibly take away to do here? So in my mind, I think the co-locating of resources is exactly a piece that we need to take. And I think we're doing that, but we can probably add to that. We can keep our kids active, and we can provide resources. What else would you say we can tangibly start doing here today as we leave this room to start making a change towards that direction?
I would say try to engage with some of those marginalized voices in the community, and it can be surveying, interviewing. There's lots of different ways to do that. Maybe work with OSU Extension to. There's just different ways to if you have a low-income housing area, I mean, just start talking to people and find out what their lived experiences of what concerns them. Because those people aren't often, you have to build in that equity to give them a voice. And this might be helpful in terms of things you can do right away.
The answer to that, Angela, is almost always communication. And the fact that you even have a forum like this and the ability to build out is important. The problem is that we don't communicate, and we don't always approach problems with the assets that we have at hand. It doesn't always require new money and new things. Sometimes it's just a question of figuring out how we can help each other, different groups with different agendas, achieve all those agendas for the good of the community. So yeah, I mean, that's always been the problem in everything, whether it's a business or a community, it's communication. I think you can somehow marshal channels of communication, you can achieve a lot.
And I think to your point about marginalized, that it's curious to me because before COVID, it meant one thing, and now I feel like our spectrum of who's marginalized is wrong overnight. I mean, could you address what marginalized means maybe in the suburbs now?
I was just thinking about people that might have lost their jobs or that are experiencing some sort of loss that way. And it might not even be financial, it could be emotional, or people struggling emotionally. I've been in my basement since March, so maybe I might look a little crazy. No, I mean, I think that's there's lots of ways to look at that. You're right, the spectrum has, and I think they look at it a little differently than what we I think that people that are living with food insecurity and poverty, their hardship is much greater than somebody like me, for example. So yeah.
I think it's also a dynamic thing, Angela. It's moving all the time. So the effects of COVID are going to shift constantly in the population. And also, when you talk about marginalized people, we always think about the breadwinners and stuff. But if you interview adolescents or you interview small children, you'll get a perspective. The anxiety is there. And remember, in food insecurity, one of the most striking things is how devastating that is in terms of embarrassment for an adolescent. A lot of suicidal ideation around that because they feel, again, that toxic stress sense that I have no control over the things that are happening around me. So, yeah, the dialogue is broad, and you could really probe many, many, many different aspects of the experiences of people living in New Albany and around New Albany. So you get a fascinating look at how it's changing over time.
Well, I guess last question, I won't keep going on, but to get to the core of it, really, I feel like in many respects, people don't understand why it matters to them. I'm doing okay, not that I'm a selfish person, but I'm doing okay, my neighbors are okay. Why does it really matter in a community to everyone?
I think the way I've always explained it to people is that you pay for it one way or another, whether you do personally and that's true of not just the financial piece of it, but also the social and emotional piece of it within the community. We pay for these things that are going around. One of the reasons we built the safety net after World War II was because people began to realize that you can't be strong and rebuild as a nation if you've got this population with all these roiling issues. So it is part of the health of the community. It is part of our own personal health and our also interactive.
Talk about social determinants of health. They've done studies that found that people that don't have as many friends and don't have as big of a social support don't live as long. And I think men in particular don't have as many friends, especially middle age. And so I think it's really important to get out and interact with people and try to make friends and volunteer places and safely as we can. I think that's one area that with the pandemic, people are kind of, obviously they're concerned about exposing themselves to the virus, but there are safe ways that we can look out for our neighbors or get involved. I play this game called pickleball. I don't really know how safe. We play outside at least, but it's like my one time of the week where I would just interact with people. And that's really been mentally very important for me, even though I am taking a little bit of a risk maybe. So I think getting out and volunteering and staying connected with our communities, that's good for our community, but it's also good for ourselves as well. And there's research to back that up.
Any final comments?
Yeah, thank you for getting me out of my basement. It's a mental health day for me.
Thank you for inviting me, and I applaud you taking on this topic. It's a tough topic, and it's something that can be a big deal if you can keep the ball rolling, keep communication going.
Thank you. We have a tremendous staff here at Healthy New Albany and the Food Pantry, very cerebral people that like to dig their hands in and sink their teeth into this material. So we are going to take the information that you've provided us and the tremendous resources, in addition to just the discussion here today. Both of our panelists have provided us toolkits and some really wonderful hands-on materials where we can take this and really begin to keep the ball rolling. So I hope it's okay. We'll stay in touch with you as we do this. I can't thank you enough for your expertise. It's been a wonderful discussion, and I'm so grateful that we've had the chance to speak with you.
Is disconnected.
We are going to continue these Lunch and Learn series. We have them planned monthly for 2021. We also have one in December coming up. Now the topic's a little bit different for December. It's called Frilitzliv. Frilitzliv is a Nordic word for open air living, which is a lifestyle dedicated to the year-round immersion in nature. So instead of us pulling ourselves in the winter, we're going to embrace the Nordic spirit of Frilutzliv and begin to see the opportunities of every season. So we're going to talk about that in December, and we do have programs from Healthy New Albany that will run all year, all through the winter, outdoor nature walks to really embrace this concept of Frilutzliv. So if that interests you, please join our walks that continue throughout the year and our lunch and learn for December. And then next year, for January of 2021, we are going to be speaking with the Ohio chapter of the American Academy of Pediatrics on SORT-safe programs for teen as well as adolescent suicide prevention. February will be a diversity topic. It's not determined quite yet. March, we will discuss ableism. April, as vaccines are ramping up, let's hope, for COVID, we'll be discussing the COVID vaccines as well as HPV. And then May will be mental health. So stay tuned. We'll have one all through next year. We'll have a monthly lunch and learn. So stay tuned in if these topics interest you. And again, thank you all for joining us in person and our panel, and for those of you at home. Stay well.
So